Ask anyone who's dealt with chronic pain over time. It can limit your mobility and wreak havoc on your quality of life. But an unusual treatment is getting some renewed attention. Manipulation under anesthesia, or MUA, is a manual therapy performed while a patient is under sedation. The therapy looks a little strange, but for some who've been suffering with pain for years, it's making a big difference.
You got these comfy blankets.
Yeah, just on the feet.
Valerie Lima knows something about pain. Too much, in fact. A car accident 2 months after back surgery sent her into a spiral of neck and back pain that lasted for years.
Immobility, severe pain, like pinched nerve kind of pain, like bent over and you stay there kind of pain.
Where's your neck today?
Like a 2-3.
Because little else has worked, Valerie is trying something dramatically different. She's come to Dr. Louis Crespo in Tampa for an uncommon therapy called MUA, or manipulation under anesthesia.
Patients come in and they've been beaten down with this chronic pain that they've dealt with day in and day out. They go to sleep with pain, they wake up with pain, and they come to see me as a last-ditch effort. Pretty good.
MUA therapy can be a little shocking to watch. Normally, the body wouldn't seem to want to move like this.
We're regaining full range of motion, breaking scar tissue, and getting the joints to move in the way that they're supposed to move.
The use of light sedation allows a team of specially trained doctors to break up the scar tissue without the patient feeling pain.
With sedation, there's no muscle guarding. So it allows us to really be able to move those joints and get to those areas without a lot of resistance from the patient, thereby avoiding injury.
As anesthesiologist Dr. Hector Vila monitors Valerie's breathing, Dr. Crespo is assisted by chiropractors Todd Cielo and Damian Rogers. They're trained in spinal manipulation.
It almost gets to be like a ballet in there because we've worked with each other so frequently that the procedures go very smoothly. We do it over a 3-day procedure so that you don't have to go as aggressive on day one and take the chance of re-injuring or injuring something else.
MUA does come with risks. Some of them include complications from anesthesia, fracture, disc herniation, tendon tears, or an increase in pain. Some insurance companies consider MUA experimental and say more studies are needed to demonstrate its safety and effectiveness. But practitioners of MUA say with today's safer methods and carefully screened candidates, this therapy can make a difference when others have failed.
Get it all done?
It's done.
Paris Ecton had tried everything. Extensive neck problems and scar tissue from related surgeries over the years left him in debilitating pain.
It was just a nightmare. My mobility range was probably about like this, and forward about like that was about, otherwise I had to turn my body to see people and talk to people.
Barely able to function, Paris was on pain pills for more than a decade.
You find that pain becomes the center of your life, of how do I get through the day, and not just for him, but as a family, right? So how's Dad feeling? What are we going to do? Are we going to go keep this social engagement? Is he up to it? Do we go with him, without him? So it becomes a centerpiece of your life.
He was a solid scar tissue from the base of his skull to his shoulders. Just a big scar web.
This clinic video shows one of 3 MUA treatments that Paris underwent. It would have a profound impact on his condition.
For the first time, we saw something that we said, wait a minute, this is working.
I was really much less pain, much more mobility. I mean, my mobility now is pretty much any way I want to move it, and I'm telling you, I could not move prior to all of this.
Paris was eventually able to get off the pain medications. He's now active and working out. Still not quite 100%, but definitely a changed man.
My wife's a lot happier because I have a sense of humor again. When you're on medications and narcotics, you're not the person you are, you're the person the drugs want you to be. They have made a huge difference in the quality of my life. Beautiful.
It was a huge turnaround for us. To see him get off all of that and to become the man I married all over again, it was a phenomenal change. Remember how she had all these plans?
All done.
Valerie Lima is hoping for a similar outcome.
Sleepy.
Just moments after the procedure, she's groggy but awake. She remembers nothing of the therapy, but she is feeling its impact.
It's like a workout pain. It's different. It's not that excruciating pain where you get up and move and everything hurts. It's not like that anymore.
On this third day of therapy, she and her husband are already noticing changes. More range of motion and less pain. A step forward.
To continue to be pain-free.
Pain-free, able to have fun with our children, our grandchildren, and see her be happy again.
MUA therapy was used in the 1940s and 50s, but was largely replaced with other pain management therapies for decades. With improved and safer options now for anesthesia, the therapy first began to reemerge as a viable alternative in the 1990s.